I have the great pleasure now to introduce Diane Reibel, Dr. Diane Reibel. Dr. Reibel is the director of the Myrna Brin Center for Mindfulness at the Marcus Institute of Integrative Health at Jefferson Health and clinical associate professor in the Department of Integrative Medicine and Nutritional Sciences at Sidney Kimmel Medical College. Dr. Reibel has taught mindfulness-based stress reduction programs for over 25 years. She has participated in professional training under the direction of John Kabat-Zinn, PhD, founder of the Stress Reduction Clinic at the University of Massachusetts Medical Center, and is certified as a mindfulness-based stress reduction program teacher through University of Massachusetts Center for Mindfulness. She is co-author of Teaching Mindfulness, a practical guide for clinicians and educators, and co-editor of Resources for Treating Mindfulness, an international handbook. Dr. Reibel bridges both a scientific foundation and wholeheartedness to her work. Her topic is the evolving field of mindfulness in healthcare. Please join me in welcoming Dr. Diane Reibel. Please, please, please.
Please, please, please. Well, thank you. Thank you so much. First, let me say that I am absolutely thrilled to be here and delighted to be able to celebrate with Dr. Pratap and Barbara and all of the people from the Sky Foundation. I have a long history with them, and I will say all I have to do is take one look at Dr. Pratap, and I smile, my heart opens, and oftentimes I'm laughing. I notice that happens a lot. So, and in addition, it's wonderful to see some old friends as well. And I noticed that I'm saying old friends, and I'm going to take that back. I'm going to say friends that I've known for many, many years. And indeed, we are getting older. We'll say it that way. And one is a shout out to Dr. Bud Brainerd, who's standing back there. And if it wasn't for Bud, I wouldn't be standing here right now. In 1996, Bud came to me and spoke to me about how the medical students at Jefferson were very stressed out and that they really wanted to do something. By the way, they're still stressed out. However, we continue to bring mindfulness programs to the medical students at Jefferson all through these years. And Bud introduced me to Dr. Stephen Rosenzweig, and they were in the process of developing an integrative medicine center at the time. And they said that bringing mindfulness in would be the first step. And that's how this began. And that was 28 years ago. And I still remember sitting in the college building at Jefferson, and I was just telling this to Bud, we were trying to decide budget, like yoga mats and cushions. But one of the most important things was we were going to make brochures. And what were we going to put on the brochures? Because at that time, people were not using the word meditation or mindfulness so much, and there was a sense that that might kind of, be a little too much and might push people away. Even John Kabat-Zinn, who developed mindfulness-based stress reduction, called it a stress reduction clinic at first. So we called it stress reduction, but we talked a little bit about mindfulness. So talk about evolving field. That was 28 years ago. And moving to this moment, Mindfulness is very popular right now. And it's a buzzword even. You can actually see advertisements for pistachios, which are called mindful nuts in the ad. I have seen in, I think it was Whole Foods, mindful mayo, mindful mayonnaise. And the last time I was in a pet store for my dog food, there was a brand called Mindful Meals for dogs. All right? So this is a whole nother story about the buzzword. All right? I'm not going to go into that story other than just to say things have really changed. What I'm going to speak about is mindfulness in healthcare. You know, how it's evolved to support people with stress, with pain, with illness. All right? So, to begin with, let's see here. I'll be talking about mindfulness and the axioms of mindfulness. I'll be describing mindfulness-based interventions that are currently used in healthcare. Talk about the research that's been done, both clinical and non-clinical populations, and then discuss current efforts to increase access to mindfulness programs for underserved communities. And what I really like to do, and for me, in my opinion, perhaps the most important, is to practice together. So I'll be guiding some mindfulness practices as we go. They're not mandatory, nothing's mandatory, but hopefully you'll join in if it works for you, okay? So, defining mindfulness and mindfulness-based interventions. There's many, many definitions of mindfulness. This is a definition that John Kabat-Zinn put out very early on. And again, he developed mindfulness-based stress reduction. And his definition is mindfulness is the awareness that arises through paying attention on purpose in the present moment with a non-judgmental attitude. Now just check in, see what's happening right now in your own inner landscape. I know for me, this can get a little complicated. John is my teacher, he's my friend, and he articulates with lots of words here. So what I'd like to do is just kind of simplify this just a little bit, and to say that mindfulness is present moment awareness. Present moment awareness. Aware of what's happening in the moment, what's happening internally, and also externally. Another way to say it and simplify it even more, it's being here now. Being present in the moment. Now, it is with specific attitudes of curiosity, openness, and non-judgment. Right? Now, if I asked you, actually, I'm going to ask you a question. What is the only guaranteed moment that you have? What are you going to say? Now. You know, I've been doing this a long time. Nobody has ever argued with me about that. Now, this is it. So doesn't it really make sense to be here now, right? To show up for your life. And most people don't argue with me about that, right? The challenge is that our minds do not stay here now that frequently. Did you notice that? Anybody notice that your mind kind of tends to lean to the past or lean to the future or daydream or so forth, right? That's where practicing mindfulness meditation comes in, to strengthen our ability to stay present. This is another way to, define mindfulness. 3 axioms of mindfulness: intention, attention, and attitude. The intention is to be here now, to be present. So the attention is focused on what is happening in the moment, here and now. The attitudes are curiosity, openness to experience, non-judgment, and kindness. Now, these three axioms, it's not a linear process. They're engaged together simultaneously when you're mindful. I think it's really important, and actually, you probably all know this by now, and we've been speaking about it a lot throughout the conference, that mindfulness, this awareness, is an innate ability, an innate capacity to be fully present and aware. Right? We are all fully present and aware at some times. Right? When you think about your own life, there are times where you are really there. Right? Perhaps it's when you're in nature, beautiful nature, or some music that you love, or speaking to a loved one. There are those moments. You're also, I'm sure, aware of the fact that many times you're not aware. Your mind is somewhere else, different than where your body is. All right? So while mindfulness is innate, it can be cultivated, it can be strengthened through the formal practice of mindfulness meditation. And that's where the mindfulness-based interventions come in, because they offer people a way to learn practices and to cultivate greater awareness. All right, so the first mindfulness-based intervention in healthcare was mindfulness-based stress reduction. And John Kabat-Zinn established it in 1979. And this is the program, amongst others, this is our foundational program that we still run at Jefferson to this day. And it's an 8-week program. People come for 2.5 hours per week. Plus, we have a day-long retreat on a weekend. It's educational, it's skill building, and it's intensive training in mindfulness meditation. It is not group therapy, and I want to make that clear. In fact, the majority of our teachers are not, I'm not a therapist, we're not therapists, it's not group therapy. However, as you'll see from some of the research, it is quite therapeutic, just by learning these ancient practices. And the classes really provide a sense of belonging. It's something that we hear time and time again, is that, you know, being together and learning together, the Sangha effect, as you will, is incredibly important, as are the daily formal mindfulness meditation practices that people are asked to do. So they're given recordings of different practices, body scanning, sitting meditation, walking meditation. I want to say that John founded the program in '79, and he wrote the book Full Catastrophe Living in 1990. All right? And then in 1993, he was highlighted in Bill Moyer's Healing and the Mind. I don't know if anyone has seen that, but it was a pivotal change in the field and in exposure. And so much so that, in fact, I was with John first in '91, and there were 30 of us there, professionals that were beginning to learn how to train and teach. That was that, pre-Bill Moyers. After the Bill Moyers show, Then the next training I went to was 250 professionals out there. So it made a really big shift there. Now it's offered in many, many more than 700 medical centers around the world. In fact, I was on a Zoom call with 350 MBSR teachers from Russia, Ukraine, Japan, China, the US. These programs can be found in many, many places. Close to 40 years of research, and MBSR and other MBIs, mindfulness-based interventions, have really expanded into corporations, the military, prisons, universities, and a lot is happening with adolescents and children. Programs, mindfulness programs in the schools, which is just really heartwarming to see the young ones learning earlier and earlier. Now, MBSR has actually stimulated the development of other mindfulness-based interventions. And these are some of the other mindfulness-based interventions. And they all share the same basic program structure, and the core of the program's the same. It's intensive training in mindfulness, but they're designed for specific populations, and other different kinds of therapies may be added. So originally, MBSR really was for patients, heterogeneous patient populations. Now you'll see both clinical and non-clinical populations coming to MBSR. We have healthcare professionals, we have students, we have people who are there basically because they're feeling burnt out from their profession and they need help, but they're not having medical issues. And then we do have people with medical issues. The second MBI that was developed was mindfulness-based cognitive therapy. And that was originally for patients with recurrent major depressions. After, I think it's 3 or 4 recurrences, this was shown to be beneficial, mindfulness-based cognitive therapy. Now it's used for chronic pain. There's mindfulness-based art therapy, which was actually originally developed here at Jefferson for breast cancer patients. Mindfulness-based relapse prevention, eating awareness training, cancer recovery. And we often say MB, ETC, etc., 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 because of how many mindfulness programs are being developed and continue to be developed. So I'm going to discuss a little of the evolving research to get a sense of where we've been in the field, where we are, and where we're going. Not that we know where we're going, okay? We don't know where exactly we're going, but we know some next steps that would be really helpful to take. So just to show you what has happened in the field, this is a graph of the research articles that have been published. All right? If you look at the year 2000, there were about 10 papers. Right? Around that time is our earliest papers. And now you look, this was up to 2022, and it's over 1,400 articles in journals, research articles. So a lot has been happening. The earliest research is Jon Kabat-Zinn's research. And at that time, he ran a 10-week stress reduction program for chronic pain patients. Basically, he was at the University of Massachusetts, and Jon is a molecular biologist by training, and he was a scientist, and he was on a meditation retreat at Insight Meditation Society, where many of us go on retreat till this day. And at that retreat, he had a vision to bring mindfulness into healthcare. And he came back And they gave him a little space in the basement, which, by the way, we started also in the basement, some commonality. And he began working with patients that, in a way, were falling through the cracks, and other physicians said, well, there's nothing more that we could do. So he started also looking, he's as a scientist, said, well, it's a good idea if we do research. And I tell you, I also believe that is one of the reasons that I can stand here today and speak, because he did decide to do research and to publish it so that people could say, well, yes, this is something that is helpful, not something, that's kind of so out there that doesn't fit a paradigm of healthcare. So these are chronic pain patients, and after 10 weeks, what they found was significant reductions in present moment pain, inhibition of activity by pain, or reduction in mood disturbance, anxiety, depression, and also pain-related drug utilization. Right? And they did follow-up studies as well, and a lot of the changes that they saw here were also still present a year later, follow-up. This was our first published paper, and a shout out to Jeff Greason back there, who's helped us with absolutely every research article I think that we've published. And we ran our 8-week program and demonstrated significant reductions, and this was a heterogeneous patient population. 45% reduction in anxiety, 35% reduction in depression, and improvements in vitality, less bodily pain, role limitations caused by physical health, better social functioning. We also did follow-up studies here, and people that did send back their forms, they also showed that after a year that these parameters were still improved. Now, the promising results and behavioral changes that people were seeing sort of elicited kind of curiosity as to what's actually happening and are there any kinds of changes physiologically. And this is one of the first studies that actually looked at brain and immune function produced by mindfulness meditation. And this was a non-clinical population in a corporate setting, and people were randomized to either MBSR or weightless control. And they did EEG studies, so brain electrical activity, and they found that the people who took the MBSR program had increased left prefrontal cortex activation with mindfulness training. Now, the left prefrontal cortex is associated with what we would call more positive affect. All right? I mean, it's not totally that simple, but in general, more positive affect. More right side is more like the anxiety and the stress response. And this was also shown to be associated with decreased trait anxiety, increased positive affect, and then in enhancement of immune function, they saw increased antibody titers to vaccine. So this was another, let me see if I get it right, a pivotal study here where they could actually show that some of the behavioral changes were indeed associated with biological, physiological changes. Now, with respect to the early research that I just showed, and there's so much more, I'm kind of keeping it as simple as I can here. The early studies were really either non-controlled, so they didn't have a control group. Like the ones that we did, it was just pre-MBSR, post-MBSR, all right, observational. This was a randomized trial. It did have a control, but it was a wait list control. So the treatments don't account for non-mindfulness specific factors. There's other things happening. You have a group coming together, you have a teacher, you have a certain amount of time. And so without those controls, you can't say, well, it's just the fact that there's mindfulness training. So more recently, researchers in the field have made great efforts to develop active treatment comparison groups, right? Control groups that control for those non-mindfulness specific treatment factors, like the group support, the home practice exercises, relaxation, placebo expectancies. And these programs provide opportunities to really evaluate whether the mindfulness interventions actually have unique treatment effects beyond these non-mindfulness specific factors. I'm going to ask you just to read this cartoon. What is that? Oh, just my mind. Can any of you relate to this? I know I can relate to this, where, at times it just feels like there's so much happening in the mind and spilling over and scattered and so forth. So I'm just going to ask you to take a moment right now and notice what is happening in your mind. Keeping in mind when you check in that mindfulness is about non-judgment. So if you notice, my God, my mind is not here at all, we're not judging that. That's not going to do anything to help anything. It's just simply, just navigate back into this moment. One of the best ways to do that is to sense your body. Sense your body sitting here now. The body is really the gateway to the present moment. So, sensing the body, opening to the visual field if you close your eyes, and see if your mind is leaning left, right, future, past, and if at all possible, just see if you can land here, kind of vertically. Just notice. And oftentimes what we can learn is actually by intention, we can come into the moment. Doesn't mean we're staying there. It doesn't mean the mind isn't going to go off somewhere. And it can happen in a millisecond. But just notice if you can come in to the moment. All right? So, these are studies that have used active controls. 47 randomized controlled trials, over 3,500 patients that compared people who took mindfulness-based programs or active control groups. And this was in JAMA, Journal of American Medical Association. And it showed that mindfulness meditation programs showed significant improvements in anxiety, depression, and pain in a diverse clinical population, including chronic pain, heart disease, fibromyalgia, IBS, and breast cancer. And again, due to these promising results, more and more researchers began to say, okay, what is happening in the brain, in the immune system, physiologically? And this looks at cognitive function. And there's mounting evidence from numerous randomized controlled trials that indicate that mindfulness interventions can improve attention-related outcomes. That's sustained attention, working memory, and effective outcomes, like reducing rumination. And that's been done primarily in healthy young adults, right? Oftentimes, college students are used for some of these studies. But there's also some evidence for improving cognition in cancer patients who have been complaining about brain fog after chemo treatments and things, and also patients with mild cognitive impairment. And this is effective mindfulness-based interventions on immunity-related biomarkers. And again, this is a meta-analysis, 48 randomized controlled trials, close to 5,000 people. And what was looked at was inflammatory markers, and there was a reduction in inflammatory markers, that's C-reactive protein and interleukin-6, an increase in CD4 T cells, which is a cellular mediated immunity, and also in telomere length and telomerase activity. And telomerase activity is associated with protecting your DNA from declining. It's often been said protects against cellular aging. And so that is, an interesting finding for sure. And the findings really support that improving immune function could likely be part of what's happening and impacting the somatic disorders, the illnesses that we've spoken about. Okay, and then just hang in there a little bit more research, and then we're going to do practice. Although, we can be practicing right now. There's no need to wait to do a formal practice. You can always check in at any moment in time and notice, where is my mind? What is happening? And make a choice, if you want, make a choice to kind of navigate into the moment. So this is a study that showed that taking an 8-week MBSR program induces brain changes similar to traditional long-term meditation practice. So it was known for quite some time that people who meditate long-term, their brains look differently than people who do not, all right? One of the things very early on that people were reporting was that the density of gray matter in the prefrontal cortex was thicker in long-term meditators, right? This is an area, where there's cognition and attention, and it's also an area that tends to thin out as we age, so that the, long-term meditators are actually making this area thicker. So this review showed that the 21 studies looking at brain function indicates that the emotional and behavioral changes observed were related to functional and structural changes in the brain. And I'm not a neurophysiologist. I'm not going to go over this too much. I own that I don't know these different areas, but I will tell you, I know them. I can't tell you exactly what every single one is located. I can say that the prefrontal cortex, the insula, these areas are associated with things like attention and memory, all right? And they're areas where there's greater connectivity happening. And additionally, the amygdala, which is associated with emotion regulation, has improved functional connectivity with the prefrontal cortex, so that there's better, people report better emotion regulation, and this supports that these areas of the brain are changing to support that better emotion regulation. All right, what are the emerging trends right now? The emerging trends are to say, time to look at these mindfulness-based interventions compared to gold standard treatments, all right? Standard treatments in allopathic medicine that are given. Where do the mindfulness-based interventions, how do they fare? So, MBIs were found to be comparable to evidence-based sleep treatments for improving quality of sleep. And again, this was done in a meta-analysis of many different studies, all right? Mindfulness-based therapies and cognitive-based therapies were statistically significantly equivalent. What it's basically saying is, you know, cognitive behavioral therapy, which is a gold standard treatment for depression, fares the same as mindfulness-based therapies do to help people with depression. And again, these are many studies that are combined. And this is one of the most recent ones. And this paper came out in 2023. And it evaluated the efficacy of MBSR compared to drug treatment for anxiety disorders, okay? So this escitalopram, which is Lexapro, some of you might have heard the name Lexapro for anxiety, was given, and they looked at how did the people fare. And this was a multi-site trial, Georgetown University, Mass General, and New York School of Medicine. And participants were randomized to either the MBSR or the drug treatment. And then anxiety levels were measured using an index that actually is clinician evaluated. So it wasn't just a subjective, although they did do subjective, well, how anxious you are, but also clinicians measuring with interviews. And what they actually found was that 8-week treatment with MBSR, we wouldn't call it a treatment, but again, we're looking at different treatments, a program treatment and, you know, a drug treatment, was found non-inferior to the drug. And again, we wouldn't necessarily call it, say it that way, but that's, you know, what the scientific lingo is. And basically, what it says is MBSR was equally as effective in helping these people reduce their anxiety as was the drug, all right? And they looked at 12 and 24 weeks follow-up and also found that the anxiety levels remained lower in both groups. One important thing, though, to mention, and one important difference is when it comes to adverse effects. So with the drug group, 80% of the people reported at least one side effect. Typical effects like sleep disturbance, nausea, fatigue, and things that can come along with certain drugs. 80% were reporting that, with only 10% in the MBSR group reporting a side effect, 10% versus 80%. And the 10% in the MBSR group, what they reported is more anxiety. Guess what? You start paying attention to your inner landscape. It's not uncommon that you start seeing how anxious you are. And not uncommon to see all your neuroses showing up for you, all right? The good news about being in a program with a teacher and with others is that that's normalized. How many people notice that sometimes they feel more anxious? How many people notice that their mind is wandering? And again, it usually resolves, all right? But there's a big difference between 80% and 10% without the drug. And also, I'm just thinking, I think there was far less dropout in the MBSR group than in the drug group, all right? So this is really an emerging trend. And we would never tell people not to take medication. I want you to know that. So we would never tell them, oh, stop taking medication, all right? Or take MBSR instead of taking your medication. That is not what we would do. However, I think it's really important for the clinical practitioners to know that this is possible. This is a supportive program that can be incredibly helpful. And who knows, maybe somebody does take the program, and with their clinician, they can decrease their medication. All right. Let's go back. Here we go. So, how many of you have your own mindfulness practice? Show of hands. Yes, okay. I would expect that in this group. So if you have your own mindfulness practice, then you're very, very aware of something called beginner's mind, all right? It's coming into the moment fresh and new, and that's what I'm going to invite you to do. So I know you have a practice, some of you, but right now is the moment fresh and new here, all right? So coming into a position that is going to really be supportive right now, that shows kind of as much ease as possible, but also can support you to be as alert as possible, which I know is not that easy post-lunch and at this time of day. However, choosing a position that you could at least start with that way. Right? And with this practice, you can certainly choose to close your eyes if that feels comfortable. Or if you choose, you can leave your eyes open. If they're open, we usually say with like a gentle gaze. And then when you're ready, bringing your attention into the body. And perhaps really sensing the support beneath you, the support of the chair, the support of the ground beneath you, beneath your feet. Not so much thinking about it as feeling it, sensing it. Sensing yourself being held in place right now by all of the forces of nature. And if you can sense into that support and being held, perhaps you don't need to hold so much right now in your body. Notice what happens when you hear me say that. Perhaps you don't need to hold so much in your body right now. Are there any muscles that could let go even just a little bit? See for yourself. Perhaps there's facial muscles that can soften. Perhaps softening around the eyes. Or if you notice that there's any type of clenching in the jaw, perhaps making a choice to simply drop the lower jaw ever so slightly, and to see how that may affect your facial muscles. And then bringing your attention to the back of the neck, feeling the muscles in the back of the neck. And if it feels right for you to move the head in any way to perhaps release any tension in the back of the neck, then doing that very gently, very mindfully, feeling the movement as you do that. And if not, then just allowing the mind to rest in the back of the neck in stillness. And any time the mind happens to wander, just gently navigating back into the moment, perhaps into the region of the neck right now. Noticing the shoulders and how they are. Get a sense, are you feeling that you're carrying weight in the shoulders? Are the shoulders relatively soft? And again, it's not about judging what you find in any way. It's about being with what you find and then making a choice to incline toward perhaps a little bit more ease. So if moving the shoulders is what feels called for, then doing that mindfully. If just allowing the mind to rest on the shoulders or anywhere else in the body that's calling out to you. Just scanning the body and seeing if there's any regions that can soften, let go a little bit. And then when you're ready, bringing your attention to the sensations of breathing. Wherever you sense the breath most vividly in this moment. It might be with air coming in and out of the nostrils. It might be with the rising and falling of the chest or the abdomen, or the whole journey of the breath in through the nose and all the way through the body. And just seeing if you can stay in touch with the full duration of an in-breath, followed by the full duration of an out-breath. And any time the mind wanders, as it naturally will, just bringing it back again, starting again to an in-breath and out-breath. And if you notice drowsiness arising, that also would be natural. And you can choose to open your eyes if they're closed or shift your posture to support some more awakeness. And then as you sit here, just opening to receive this short poem by David White called Enough. These few words are enough. If not these words, this breath. If not this breath, this sitting here, this opening to life, the life that we have refused again and again until now, until now. These few words are enough. If not these words, this breath, this precious, life-giving breath. And just notice whatever quality or qualities are most present for you in this moment. Bringing your attention to the body as a whole, sitting once again, the entirety of the body. And if your eyes are closed, just gently allow them to open to the visual field. And as you open to the visual field, as much as possible, staying in touch with the sense of your body. We often open to the visual field and everything comes from here upward, and we forget that we have these amazing bodies. So, sensing the body sitting, opening to the visual field, opening to the sounds, and as much as possible, an embodied presence in the moment. Right? If you are noticing that you are really on the edge of sleep, and again, we're not judging, okay? I mean, sleep is important, but if you are noticing that you are, you can really take a moment and move your body, all right? In fact, why don't we do that before I go on here? And I only have a few more PowerPoints, but if you'd like, again, standing up, and we're just going to take, a minute to two maybe, to shake our bodies, all right? So, yeah, flick those wrists. And again, only if it feels right to you. Bring in the shoulders, bring in the hips, and also the legs. Just shake it up. And now we're going to shake it to the left. Okay. We're going to shake it to the right. Starting to feel like the hokey pokey here. We're going to shake to the forward. And shake to the back. And shake it up. And then just pause and feel life coursing through your body. All right? Tingling, pulsing, temperature. See? Just a little bit of movement can, I believe, support presence. How many of you feel pretty present right now? Yeah? Okay. Actually, that is what the hokey pokey is all about. All right? It's about put your whole self in. And that is what mindfulness is, right? So we'll have another seat. So it's important, I totally believe, to speak about limitations in the field. And one of the biggest limitations in the field is there are only a few studies that include people with low socioeconomic status and people of color. All right? So we have done 40 years of research. And if you look at the demographics, what you find, and these are studies from 2000 to 2016, 94 randomized controlled trials look at the demographics. Close to 80% white, middle-aged, highly educated, predominantly female. This is what we have seen through the years. And we have made efforts to bring in more diversity, and it is happening slowly. All right? What we find is what we need to be doing is going out into the diverse communities, meeting the people where they're at. They're not necessarily going to just come, to our door. So people in the field are really trying to step up to meet this need, and these are just a few that I can speak to, that they've developed and adapted mindfulness-based programs for racially and economically marginalized patients in the Bronx. Bronx is considered the most diverse section of the United States. What they're doing is they're adapting, making it culturally accessible. This is so important, all right? So the program's a 16-week program. People meet for an hour a week. And this is because this is the time limitations that people can have, all right? The core practices are similar, all right? But the format's different. And building more diverse and inclusive science, MBIs for the Latinx populations, and also Native American communities. And I love what they're doing in the Native American communities. They really are making it so culturally accessible. So for example, you'll hear many of us ringing bells at the start of a meditation. I don't tend to do that. I want people just to be mindful, period. Not that it's ending and beginning, but nonetheless, we do use bells. They use drums. Why not use drums? This is what the natives use, all right? They do rituals that are important to open the space, to close the space, all right? So this is really what we need more of now. Just to say that, what we have been doing to reach other communities, we've run mindfulness tools for chronic pain management at Project Hope, which is healthcare for the homeless. These are people who are trying to get off of opioids, and this was an incredibly successful program. The people were saying that they are listening to a CD or listening on their phone when they start craving, the drug. I'm not saying it's the end-all and be-all, but little steps make a huge difference. We adapted MBSR for older adults. So it's like what Barbara's doing with Golden Yoga, we've been doing also with mindfulness programs. And we have mean age of 82 in our programs. And we actually looked at brain function in these older adults, which seems odd for me to be using older adults, but whatever. That's what I am these days. And we found that there was, after 8 weeks of MBSR, in these people at this age, their brain changes in more positive ways, all right? Similar to what happens with even younger people. So anybody who tells you that we can't learn, we can't change, I don't like to say, but teach old dog, new tricks kind of things, it's not true, it just isn't true. And you all know that anyhow. Mindfulness for visually impaired, and then we run an innovative program for people with ALS, which Elise Moss, who works with me, and thank God she does, she and I are running a program right now for ALS patients. And yes, it's not that we're going to cure these patients by any means, but if we can help them with any ounce of quality of life, in the moment, to us that means a lot. And to them, from what we gather, means a lot. In fact, last week, we got a message from one of our participants in the ALS program who has no movement whatsoever, all right? Who is got a trach tube, he's on a ventilator, and he wrote us, and somebody wrote it for him, to say that he had a panic attack and it's something he has not had in a long time. And his nurse and his wife ran to get medication to put in his tube, into his feeding tube. But while they were running to get the medication, he turned on the meditation, which was a body scan, started listening. By the time they got back, he didn't have the panic attack. He said his heart rate was down. They didn't even have to give him the medication. Right? You know, it's very touching. It's very touching to see people responding. And again, I'm not saying it's everyone, but we do hear a lot of people speaking about change. So, what's really important as we move forward? Training teachers from diverse communities to go back into their communities to teach mindfulness. That's what we need, all right? And universities are doing this now more than ever. And then, outside of universities, there's a program, Freedom Together. It's a global mindfulness teacher training program to create and support a community of Black, Asian, Indigenous, and people of color mindfulness teachers who can use their collective wisdom to liberate their own communities. And this is what is needed to have greater access. Finally, again, this is moving forward to increase development and implementation of mindfulness programs for underserved, underrepresented communities, research addressing these racial and socioeconomic diverse populations, dosing, how much mindfulness-based intervention or mindfulness practice is really needed to see the benefits. I still can't tell you that after all these years. Some papers say, oh, yes, it's like the more you practice, the more you benefit. Other papers say, no, it doesn't. It's not definitely linearly correlated. Investigating the mechanisms involved with the observed physical and mental health effects, and research on the efficacy of web-based and apps, all right? So there's definitely increased access through apps, right? Very little research has been done. I can't tell you, the efficacy of most of the apps. I mean, I do believe that a lot of people are gaining from listening to mindfulness meditation practices on apps, but I can't tell you more than that, and I can't tell you if there's any harm that's created. When you're doing it on the app, you don't have a teacher to ask, if there's issues and you don't have a group to come together. So these are questions that remain and we need to be looking at. So thank you. So if there's any questions. Jeff.
Thank you so much. Oh my goodness, thank you, Diane. Here's a question.
Uh-oh, I can tell by your voice. Go ahead.
I don't know if I've ever asked anyone. It's a common question in the field, but I don't know if we've ever discussed this. So I'm thinking of Bud, how he got the funding from NASA or whatever to send the photometer up to the International Space Station, because if you're studying light and you can't measure the independent variable, you got no study on your hands. So if you're studying light and it's being emitted, how do you measure it? The photometer or whatever the machine. If we're studying stress, we can take a blood sample or saliva and you can measure some cortisol levels, the stress hormone. How are we supposed to measure mindfulness?
Good question. And as well as I do right now, that we don't have a good way to measure mindfulness right now, all right? We have a lot of scales, a lot of what are called validated scales, but they're validated, and then you look at this scale, and they give that with that scale, and they have different results when you give it to the same population. So we really don't have that. I think the closest to come is Richie Davidson, who has you actually focusing attention, but even that's more concentration practice than it is. So, Jeff, you're the researcher. My suggestion is
dang.
let's get to work on this. But yes.
That was a little bit of a trick question. There is no answer to that,
There's
but
no
it's
answer.
a struggle because
It
in
is.
science and sort of trying to objectify this stuff of consciousness, and it's like people gloss right over that. They get into the brain imaging and all this other stuff, but it's like, wait a second, mindfulness, it's all these different qualities. You can ask people on a questionnaire, you can measure different areas of the brain or take all sorts of gene expression, but what of all those things, like, is the mindfulness, and based on what even is mindfulness? So that's a big question, in the field. I don't think anybody has a good answer to that, and yet there are programs, there's trainings, there's about 1,400 studies a year coming out, none of which, address that very simple question. So everybody, that was an unfair question, I apologize, but I think it's important to at least think about that.
No, it's a good question, and I hopefully answered it in the right way, which is I just don't know, and neither do we know, and that is the truth, and that is the limitation. I mean, there are many things that we can't measure. There's many things, and it's what Bud was saying, even with, there's so much that we don't see or that we are not going to be able necessarily to touch right now, but maybe in the future, yes. Thank you, Jeff.
I want to weigh in on that
Yes.
because I think what you're talking about measuring is very temporal.
Yes.
You're talking about effects having practiced for a limited amount of time, and those effects are going to be demonstrated for a little bit of time, which is the nature of practice. So measuring the sound in the room for how many minutes after that practice is done, measuring the image of faces, how tense or relaxed they are after a practice, and knowing that you can't hold on to the results or the effects of any practice till the next day. You have to practice, which is the nature of what you're teaching people to do. Mm-hmm. So the fact that in that moment there's a change in the way the room feels is the measure of your success, as opposed to there's a survey you can do. We don't get away with practicing yoga once and carry the benefits forever.
I hear what you're saying, and I do feel that there are certain things, like what you're saying, the temperature in the room, I'm using the word temperature, or things that are happening right after practice, okay? That is, state mindfulness, what we would call state mindfulness. There is also something called trait mindfulness, right? Where some people are just more mindful and aware than others, period. They come out a certain way. But then also, that can shift and change with practice. The brain can shift and change. And I'll give you the example. John's first study with the EKG, okay? It wasn't the shift in the brain that was happening while they were meditating. It was the shift that was happening after 8 weeks, okay? That stayed. There are shifts that can stay and remain, all right? And even in our study, and again, I can't explain everything scientifically, but in some of the studies where they're doing follow-ups, right, and let's say a lot of parameters changed right after the 8-week program, and then they look at a year later, and the changes are still there. Some of those people continue to practice formally, but some of them don't. How do you explain that? Well, there's something going on. There's some changes that can take place that shift and have paradigm shifts with people that then can support them to be less depressed, less anxious. So for example, I'll just give you an example. if someone comes to us and they're not aware of the fact that they're not just their thoughts, right? And then they come to the program and they start having a direct experience. Oh my God, I'm not just my thoughts. I'm bigger than my thoughts. I can see my thoughts. I'm not just these emotions. I can feel them, but there's something bigger, right? This awareness itself. Just that direct experience can shift a person and stay with them. Does that make sense to you?
Yes, and I think what you're describing in measurement is never going to be a constant because you're talking about different fertility within the development of those inner listening skills. There's an epiphanic transition that can happen when somebody has that revelation, and then somebody else may not have that for a long time. So it's hard to try to get a baseline for multiple experiences, and every different person in the room is going to be a different baseline. And I'm only saying that I'm not sure there's going to be a constant for the type of scientific measuring that happens within the individual evolution of a person.
I agree with you. I wasn't getting, I'm glad, I was about to say, I'll tell you my inner workings. I was about to say, can I answer your question of like what's under this? Like I'm kind of trying to go with you, but I don't know what's under it, and there it is. So thank you, and I agree with you. Great.
Thank you.
All right. Yes.
Not to like beat on this subject, but couldn't you take a cortisol test, like levels and inflammatory markers before the 8-week session, and then do them again after?
Absolutely, and it's been done. Yes.
Yeah, so that's measurable.
Yes, that is there are certain things that are measurable, right? And not specific to any one specific person, but as groups, yes, you can come to some kind of, conclusion, tentative conclusion, we'll say, with groups, yes.
Go get.
Yes.
So I heard you talking about measuring. Hi, I heard you talking about measuring pain
Yes.
and anxiety
Yes.
and depression and noticing decreases and, improvements in all these areas as a result of these practices. So I'm not really understanding why it's being discussed as not measured when you're measuring those things.
I think I think first it was how do we measure mindfulness? It's not so easy, to measure mindfulness. And then it was a bit more of, there's so many factors and so many things. There's state mindfulness and trait mindfulness and so forth that are involved with change in any one given individual. However, that does not take away from the fact that you can look at things like anxiety. You can look at things like pain. Not only subjective reports, all right, like I can say this or that, but you can also do it in other ways. Like I said, the one where they looked at the drug and anxiety, it's actually not just self-report. It's clinicians looking for certain traits and certain things like that, okay? There's a new study that just came out looking at pain, looking at the brain and pathways to pain, all right, which is, more physiological and showing that there's pathways in the brain that regulate pain that shift when people are practicing mindfulness. So things are happening. Does that support you in what I just said? Okay, good. Is there anything else? I'd like to do another short practice, but go ahead.
What is the difference between the
So state mindfulness is really, like right now, how mindful are we in this moment? And that's going to change a lot, moment to moment. Whereas trait anxiety is more like a trait that someone would have. Someone who is more mindful or less mindful in general, overall, through time. Okay. Is there anything else? Really, I'm happy to answer a question and let go of practice if that feels better. Yes.
Here, wait. I've heard some people say, oh, I can't meditate, I have anxiety. And the research that you present, and we've heard time again, is that it helps to reduce anxiety. What would you say to somebody who says, oh, I can't do that, I have anxiety?
Mm-hmm. Well, if they were open to it, I probably wouldn't go on and on talking. I would probably ask them if they're open to do just a short practice. Just because, again, talking about it doesn't always, you know what I mean? But it does help to bring forth that there's a lot of science, too. Both are important. There's a lot of science that shows that people who are anxious actually really do benefit from practicing mindfulness. And it's not about always being on your breath and being totally focused. It's not about that. It's about learning how to be more kind, curious, and open, even if you are anxious, so that you kind of learn how to handle, in a way, your anxiety in a better way. These are thoughts that are coming right now. But from my experience is talking about it isn't the same as actually doing it. So we have people time and time again in our classes who, are getting ready, like to have a panic attack. It's not the time to start talking to them about how great the science is. That is not going to help them, okay? What's going to help them is to guide them, to feel what's happening, to be present, to notice what are they telling themselves, and the difference between what they're telling themselves in the moment versus what's actually happening. All right? Oh, I'm going to have a panic attack. Oh, da-da-da-da. Oh, they're thoughts. They're just thoughts. Can you come into the body? Can you just feel the body? Can you feel your feet on the floor? Can you feel? Things shift and change when you do that. And then they have the direct experience of, oh my God, I'm not having my panic attack. Usually, I can't say always, but more often than not, if you work with them that way, they'll calm down.
I have a question. At my senior center, where we have it in Chestnut Hill, it's expensive. Mm-hmm. Yeah, why does it cost so much? It's something like $100 a month or $30 a week, I forget, but it's more than I could afford. I was going to sign up.
So I can't speak about what your particular place in Chestnut Hill is costing and so forth. The programs do come at a cost, and we do charge, it's $425.95 now?
How much is it a month for you?
Oh God, you have to figure that out. But let me tell you this that's more important. We give scholarships. Okay, this is important for all of you to hear in case you or anyone else you want to send to our programs. Since the very beginning, 28 years ago, I said we are going to tithe. We are going to give financial assistance to people who need it.
You're going to do what? I couldn't hear.
We financially support people. So, for example, I can't speak to you about Chestnut Hill. However, if you are interested in an MBSR program and we can support you to do it through scholarship, we really,
I see.
yes,
I
we
see.
do our
Okay.
best to do that.
I see.
So
Okay.
you might want to look up our program, okay?
I see.
Anything else? Let me check the time here. I know we've been sitting for a long time, and I know Master Ho is coming up. So this is what I'm going to do, is read a poem if it's okay. All right? And just close with this, and then you have a few minutes break. I think this is a really a good poem to support uncertain times. So I'm asking you to put on your mindful listening ears. This is called Never the Same by Rosemary Watala Tromer. Sometimes a person wakes believing they are a storm. It's hard to deny it. What with all the rain pouring out of the gutters of the mind, all the gusts blowing through, all the squalls, all the gray. But by afternoon, it seems obvious they are a garden about to sprout. By night, it is clear they are a full moon, luminous, radiant, faithful. That's the danger, I suppose, of believing any one frame. Let me believe then in curiosity, in wonder, in change. Let me trust how essential it is to stumble into the trough of the unknown. Marvel how the trough becomes wings, becomes faith. Let me trust uncertainty is a sacred path. Let me trust that uncertainty is a sacred path. Thank you, everybody.